Good, by God's grace.
Great.
Yeah.
The conversation about drug abuse is taking center stage.
Yes.
Wunim Red is one of the very popular ones. The last time we were here, we were talking about it.
Yeah.
Let's look at that and mental health.
Okay.
Especially knowing that in this our country, we have not put mental health on the front burner. Budgetary allocation and disbursement and everything else is at the lowest bar.
Yeah.
But let's begin. This red menace and mental health, is there a correlation?
Yeah, so first of all, today is an International Day Against Drug Abuse and Illegal Trafficking.
That's correct.
It's a day assigned by the UN, United Nations, to collaborate global efforts to try to help curb the menace of drug abuse and illegal trafficking. So first of all, we need to know what drug abuse is.
Right.
So drug abuse is the intentional use of legal and illegal drugs that affect negatively your health, your physical, your social, and your mental health. So any drug you use intentionally and that affects you negatively, it's drug abuse. It could be in a form of using more than you have been prescribed to use. Okay. That's one. It could be that you're using someone else's drugs, that's medications.
Right.
You know, there's also always a confusion, medications and drugs. So when we talk about drugs, we're talking about the illegal ones.
Okay.
Medications, we are trying to refer generally to the ones that are prescribed.
Okay. So illegal ones were cocaine,
heroin, the tramadol, and the rest. Yeah, marijuana, and the rest.
And then the legal ones will be your paracetamol, your ampicillin.
Exactly. So those are also, you can abuse those ones, and those are also called drug abuse. So either you're using more than prescribed for you, or you're using someone else's medication, which means it wasn't prescribed for you, but you're using it.
Okay. How does that happen? So, Sedo here is my friend, or is my cousin. We live in the same house. He had a back pain. Doctor prescribed this for him. I have a back pain later. I don't go to the doctor. I start taking it because
it's wrong.
We live in the same house. Possibly what can help him can help me. People do that, don't they?
A lot of people do that. It's wrong because reason why that particular medication was prescribed, you don't know why. And there could be contraindications in you. For example, if you're using some medications and maybe that person, your friend has asthma.
Okay.
And there are some medications that people who have asthma should not use. Because you all have the same condition doesn't mean you can also use the same medication.
Right.
And so there are a lot of reasons that are put into consideration before a prescription is made.
Right.
So one, either you're using more than you're prescribed. Two, you're using someone else's medication, or you're using the illegal ones. That's the cocaine, the heroin, the marijuana, and these days on the rise is vaping and the balloon.
Right.
Nitrous oxide. Now, this drug abuse has impact on mental health.
Okay.
It's a bi-directional affair. It goes both ways. So drug abuse can precipitate mental illnesses, all right? And mental illness can also impact on drug use.
Right.
All right? So there are a lot of people with certain mental illnesses that predispose them to the likelihood of using of engaging in drug abuse. A lot of the youth are battling silently depression, anxiety. Some of them are going through post-traumatic stress disorder. Some have attention deficit hyperactive disorder. A lot of them are going through a lot of things. It could be schizophrenia.
Right.
And these drugs are being used wrongly, unaware, as a form of self-medication. They experiment through peer influence.
Right.
And depending on how they feel, they like it. And they want to continue feeling the same.
Right.
For example, if somebody is feeling down and he takes a drug, substance of abuse, and he feels a little better than that, chances are higher that he or she will likely go back using the same
each time he feels down.
Each time he feels down.
Without properly going to a specialist to check.
Exactly. Exactly. So sometimes there is an underlying undiagnosed mental illness that may push a person to continue using. The experimentation, a lot of people experiment, but not all of them continue using.
Okay.
Because there are certain drugs that people use, instead of having euphoria, which is the good feeling, the high feeling, some people have dysphoria, which is the uncomfortable feeling.
Okay.
So specifically the Wunim Red that you're talking about, that is high dose tramadol.
Right.
There are people that when they take tramadol or any opioid for that matter, they have dysphoria. So instead of the high good feeling, all relaxed and all that, they feel uncomfortable, they vomit. So they will not want to have anything to do with any opioids at all, and they know. But there are some people, when they are introduced to these opioids, could be tramadol, could be petidine, could be fentanyl, could be any of them, they like the feeling. And they want to feel the same way over and over, far beyond the prescribed number of days or the dosage, to the point of where they will need higher doses over time to feel a little similar to what they felt the first time. Because it's an issue of chasing the high. You're not likely to ever feel the same kind of high the first time.
So those who, for example, have a headache, they say, the headache is too severe, I can't take 2 tablets of paracetamol as my doctor has prescribed, I want to take 4. And then the next time it becomes 4 for them, which is normal. And then again it goes to 6. And then before you know it, they are swallowing 8 pills each time they have a... That's what you're describing.
So that is tolerance. Where your body becomes used to the drug, the effect of it, that you need more to achieve a similar effect. That's tolerance. When it begins to happen like that, it's a sign that you are getting into drug abuse. So chances are that instead of taking 2 tablets of paracetamol, maybe every 8 hours, every 6 hours, now you're taking 8. You're taking, before you know, you're taking 10. And paracetamol, as innocent as it looks and sounds, has very dangerous side effects.
For example,
affect your liver. It can affect your liver. It can damage your liver. You understand? So just stick to the prescribed dosage. If you think you need more, seek medical advice. That's why you have to go and see the doctor. And there are a lot of factors that are considered before a particular medication and a particular dose regimen is given you.
Let's talk about sleeping tablets.
And
how people abuse it.
It's very common.
Say, I can't sleep. Swallows 1 or 2, and then I can sleep, and then it becomes a normal thing. Let's talk about that.
So, these days there's stress everywhere. There's supposed to be normal daily stress that we're all supposed to overcome as part of our mental health and well-being. But because of stress, a lot of people are not able to have good sleep. A lot of people have only a few hours that is available to them to sleep. So they want to, once they fall on the bed, they want to sleep quickly. So they most likely want to resort to using aids. People are using D5, D10, that's diazepam. Now, it will sedate you, help you to sleep, but it's highly addictive, which means again that after some time, the 5 milligram, the 10 milligram may not be enough. You will be forced to use higher doses. And you see, it's sedating you, at those doses. It means the more you become tolerant, needing higher doses, chances are that you keep on using higher doses, you might sleep and not wake up. You might sleep and not wake up. That risk is inherent in the use of such sleeping aids.
As in you would die?
Yes. That's just a
Your
nice
sleeping tablet can kill you.
Yes. You overdose it. Tramadol can kill you. You overdose it because you're also sedating. So those you see sleeping, slurry speech, and they're normal, that's how it shows. And you can overdose on it because of the tolerance.
But when you talk to the boys, they say they take it because they want to have peace of mind. Is there anything like peace of mind in tramadol?
It's subjective. The individual experiences by the people who use it, it's subjective. You understand? And because of the euphoria feeling, that euphoria feeling, like I said, is because of the chemical that is released when these substances are used, dopamine, and it gives you euphoria. It's a like feel good kind of thing that people experience. And initially, they use it because they want to have that, and on top of that, they will tell you they use it because they want to work harder, longer. Most of the people who use it, Okada riders, long distance drivers, laborers, most of the laborers that we know, masons and all these, they use it because they want to work harder, longer. And because of how they feel good, the highness that they feel, that's what makes them continue using. But they are not aware that it can, in the long run, affect them negatively, such that the very thing they want to do longer, harder, they are not able to do it. Because if you want to work harder, maybe as a mason or as a trotro mate or as a potter, when you are sleepy, you are slow, like you see in the videos and the pictures, and you can't walk, you can't talk, there's no way you're going to work.
That's right.
So people use it without knowing how badly it can affect them. That's why there's a need for awareness creation, for people to know that this very thing that you are starting, it's going to get to a point that you cannot stop. Not because you don't want to stop. So there are two phases. The impulsive phase is you use it without knowing the negative effect. So to mostly fuel by peer influence. Friends, SHS, home, at a party ground. And these are a lot of parties that people even take things they're not even aware of. In the punches.
Really?
Yes, cocktails. So you go there's a cocktail. You don't know what has been made. It's a cocktail, mixture of things.
Everything.
The things inside, you're not aware of it. So it could be marijuana, it could be cocaine, it could be tramadol, it could be things mixed up. Anything at all can be given you without your knowledge.
Right.
So People don't know the negative consequences of using these substances, these drugs, and then they start. That's impulsive phase.
Okay.
The compulsive phase becomes that's why a lot of people say, I feel it is spiritual because I'm forced to use even though I don't want to use. That's a compulsive phase because your body has become used to it.
Okay, so now your body is demanding.
Your body is demanding, forcing you to do it. That's the force behind it.
Okay.
So without its use, or if you even reduce the dose that you are used to, suddenly your body will go through what we call withdrawal effect.
Okay.
And the withdrawal effect is a negative as the opposite, the very opposite of the direct opposite of what you feel when you take the drugs.
Right.
So if you used to feel happy, you feel happy, relaxed, you feel sleepy. If you don't take it, you will not be able to sleep. You feel very sad, you'll be agitated, you become you get angry easily. So the very opposite of what you feel when you take the drugs. So to avoid that, a lot of people go back using and using and using. So they become enslaved to the drug.
Right.
So initially you start using the drugs, and after something the drug continues to use you. So if they are aware of this, most of them will not even start. And aside that, it affects your finances and your relationships.
But some people think that, look, taking drugs is now a status symbol. You be hard guy. If Fofi injects the heroin, you be hard guy. You have to sniff the coke or smoke the weed. You be hard guy. You have to take red. And you find that people actually have maybe 12 tablets of red at a go.
Yeah.
They pop everything out. They're live on, and the videos are on social media.
Yeah, we see them.
And then they toss everything into their mouth and add some energy drink. And Charlie, they just want to prove say they be guy. What are they doing? Tell me.
So you see, as humans, we are social beings. We do not survive alone. So some way, somehow, we all conform to certain norms.
Right.
If you are around people who use, you are likely to use. So that's why. So peer influence is a big deal. That's why the kind of people you associate with. If you are working, if there are 4 people, if you are working with 4 wise people, it means you actually did not count well. It means there are actually 5 wise people because you are likely to copy whatever it is they are doing. So people want to conform. The peer influence is so strong.
Right.
It doesn't necessarily mean you are. There are other people as well who are not using, who are even doing far better than you. It's just that you find yourself in the wrong group, the wrong company.
Right.
And social media is making these things very easy these days. A lot of people are glamorizing it. Some of the people who people look up to, celebrities, glamorizing it, using these illegal drugs openly, online, live. And these young ones, after some age, they don't listen to their parents anymore. They listen more to their mentors and their peers. And these people influence whatever they do. So that's what the problem. So using of drugs is not a form of showing that you are a guy. No, it's not. It doesn't end well. That's what people need to know.
At what point would you know that, look, I am abusing this, I need to step back, and is it easy for you to step back?
Okay, so 2 questions in one. At what point would you know you are abusing it? Simple. If it's an illegal drug, you are abusing it. It's not, you're not supposed to be using it in the first place.
Right.
If it's a legal drug prescribed for you, if you're using it beyond how the prescription is said, you are abusing it. So that is also wrong.
How do you step back if you notice it?
Okay, if it's a legal drug and you've not gotten too far, just go back to speak to the doctor to guide you, to help you gradually step down.
Right.
For example, if you're using, say, the D5 or D10, and you got into a point where you're like, no, the doctor said I should take it 1 every night, but these days I take it 3 tablets, 4 tablets. Go back to that doctor. He will help you step down gradually, and that's it. And if it's an illegal drug, of course, again, and you've gone too far, your withdrawal effect is affecting you badly, again, you need to seek medical help.
Okay.
Most often than not. So most people start using these drugs by choice.
Okay.
Most of them through peer influence. But after the drugs have caused a lot of changes in your brain, it gets to the compulsive phase where you cannot stop on your own.
Okay.
It becomes extremely difficult.
Somebody has to help you.
Most often than not. Only few people are able to stop it on their own and able to remain in recovery for life. But most people will need help. A lot of people have very high, what we call high self-efficacy.
Okay.
That is, you have what it takes to stop and never go back to using. But most people are not able to. They keep going back and back over and over again because of the withdrawal effect. So you will need help, and there is help available. You come to the hospital, we will help you. The first phase that we're going to help you with is the detoxification.
Okay.
Where we help you with medication. So medication-assisted treatment. Where we help give you medications that will ease the negative impact of the withdrawal effect.
Okay.
So typically, the Wunim read that we've been talking about.
Right.
The withdrawal effect is nausea, vomiting, abdominal pains, joint pains, agitation, irritability, all these things times 10. It's very severe that you can't do it on your own. You are likely going to go back to the Winning Red.
Okay.
Just so that all these symptoms will go away. So because of that, you want to stop. That's a good one. So you come to us. We're going to give medication to take off all the symptoms.
Okay.
The vomiting, we're going to give medication for it. The nausea, the pain, all the feelings that you're going to have, the agitation, we're going to give medication for all of these things. So whilst you're on admission, for between 5 to 10 days, you'll be on admission.
Okay.
We're going to take care of that for you. That's the first phase. Beyond that, then we advise you go for rehabilitation. And the rehabilitation, we have two forms. The residential one that you go and stay there for at least 6 months.
Okay.
And then the outpatient one, where we have some in Kolebu, across Academy Hospital and Pantang, and maybe some few other places.
So they can come and go back home.
Yeah, you can come and go back
somebody
home.
has to supervise them at home. Somebody.
Best practices, yes. Somebody has to supervise you. And that one, you have to have a really strong motivation that you are not going to go back using. Because see, beyond the maybe 3 to 4 or 5 hours of the training that you're going to have outpatient, the rest of the day you're on your own. You can actually go and use, and nobody may be there to see. So you have to have a strong motivation. But when it comes to the opioids, because we know how difficult it is to get off and how intense the withdrawal effects are, we always advise a residential rehabilitation for the opioids. And sometimes also the nicotine. Nicotine is highly, highly addictive, and these days it's become...
That's the cigarette.
The cigarette.
And now you have people have electronic cigarettes.
That's the vaping I'm talking about. Vaping among JSS and SHS pupils and students.
Sometimes I saw one the other time. I thought the kid had an eraser.
It's a vape.
It was so colorful.
Yes.
Until I saw them at one corner
pulling. Yeah.
I said, what?
Yes. Yes. That's how glamorous.
I thought it was some eraser that the children had. So me, I was just looking at them, and then they were moving towards the far end of the corner. So I said, okay. Then I saw the smoke. I said, wow.
Yes. It's flavored, it's colorful, it's fancy. So you're not able to tell that this is a bad thing. And it's kind of acceptable because you're not smoking a stick with a fire at the end, with a smoke and a smell for everybody to suspect you. So it goes without notice for a long time. And lots of lots of the private schools have a lot of children.
The Dadabi children.
The Dadabi children. Because of affordability, again, it's a little expensive. So people who went to my kind of schools may not be able to afford.
Yeah, you are Saito school.
You get that, you see that. Kaneshi Kingsway 3 years, you know. So
Kaneshi Anglican.
Okay. So you
close.
See, yeah, we're very, very close. So you see, it's common among the private schools, and most of these Dadabis, we all know the story, so I don't want to go.
You spoke about being in recovery for a long time.
Yes. So addiction is recognized now as a chronic brain disorder.
Okay.
Which comes with loss of control of use or engagement in certain behaviors or activities, and it's coupled with craving and use. Despite negative consequences.
Right.
So if you ask us what is addiction, it comes with the 3 C's. All right. So there's compulsive use, loss of control. Loss of control, there's craving, and there's continuous use despite negative consequences.
Right.
So you know this drug that you're using or this behavior you're engaging, it's not good for you, but you still go ahead and continue doing it. Now, so it's a chronic medical condition, brain disorder. It's like in DSM-5 as a mental illness. It's not curable. Just like hypertension, diabetes, asthma, sickle cell. It's not curable. It's long-term, but there's treatment available for it. There's no cure, but there's treatment available for it. Once you stop using the drugs, and we give medication to assist you with the withdrawal effect and everything, and you go through training, through the rehab, forever you are in recovery. We will not say you have been cured of cocaine use, cured of tramadol use, or cured of... No. You are in recovery. And what we always teach them is you take it 1 day at a time. So there are people who will tell you, I'm 1,000 days in recovery. I'm 5 days in recovery. I'm 20 days in recovery. But the day you go back using, you start from zero.
All those days
it's gone.
Are gone.
Yes.
You're back into the mud.
Because what we all need to understand is relapse is quite common among people who are highly dependent on these drugs.
Okay.
And we've accepted that relapse is part of the journey, even though we wish nobody relapses. But we've accepted it. We only try to look at the positive side of the relapse. When you have a relapse or there's a relapse, we look at what caused the relapse.
Okay.
So as for it not to happen again.
Your associations, for example,
people, places, things, circumstances. Those are things you have to avoid if you want to be in good recovery. People, places, things, and circumstances. You have to avoid these ones because the very people are the people who got you into it. The places got you into it. When you go to maybe a pub, a nightclub, some parties, some birthday parties.
It's in your face.
It's all there. This is, yesterday I was talking to somebody, he said he didn't even know the balloon that he sees at parties and nightclubs has something inside.
Yeah.
He thought it was just a fancy
I didn't know too. I thought they were just playing, you know.
It has nitrous oxide.
What's that?
It's a drug, it's a gas we use in theater to put patient to sleep.
Hey.
It's a laughing gas. So people who start using it will laugh when they start using it. But when your body becomes used to it, you don't laugh anymore. You just want more and more.
Can we call it in blue?
And you see, it's fancy. See the colorful balloons and everybody just like that. You wouldn't know they are inhaling something. It can affect your brain in a lot of ways. Similar to how the other drugs. You see, people think it's safe, but you can become dependent on it and you'll be consuming more and more and more, and it will affect your voice, will be affected, your brain will be affected, a lot of it.
I know that this whole International Day drug abuse, against drug abuse and illicit trafficking started in 1989.
Yes.
Since 1989, what successes have we chalked in Ghana, for example?
So you see, the laws keeps being stringent. For example, right now, through these collaborative international efforts, you will say that tramadol, the high-dose tramadol is illegal. It's not FDA approved in Ghana. And through these awareness creations, people now know that there's something called Winifred, there's something called Trafrodol, there's something called this and that, and it's illegal, and it has this negative effect. So through commemoration of these days, annually, 26th June every year, awareness is created, and the focus is to advocate for treatments for people who are dependent on these drugs. Not just necessarily incarceration. You understand? Not just punishment, but to give them treatment, because most of these people need help. Like I've just told you, it's a mental illness. It's a chronic brain disorder. It's not like they have a weak will or they are weak or they are not strong enough. Not necessarily. Truly, they started maybe by choice, but their continuous use is not by choice. They have to. If not, the withdrawal effect will take over, and they don't want to feel that way. And most people cannot wake out of bed, for example, who are alcohol dependent. People who are living with alcohol use disorder. They are not able to get out of bed without what we call the eye opener.
What's that?
Eye opener, taking alcohol early in the morning. So if you are a rich person, you have whiskey and co in the fridge. If you are from the slums, you are poor, you have akpete sheet under your bed.
The bed.
Or early morning, you run to the blue kiosk.
You are the one who wakes Davy up.
Exactly. And that's a common story. You go and wake the Davy up to give you one, comfort.
You wake them up.
Mami Efua, whatever. See, so these people have a chronic brain disorder and they need help. Using of these drugs also increases your chance of engaging in vices, social vices, criminal activities. So most of them find themselves on the wrong side of the law, where the law wants to be very strict, put them into prison for long years and all that. UN, United Nations, is advocating for treatment, seeking treatment for these people, which means that government effort has to be beefed up when it comes to resourcing these treatment centers, when it comes to training experts in the field, when it comes to, monitoring. The law enforcement agencies, we're talking about FDA, Immigration, Customs, Police, Narcotics Control Commission, all of them have to have a concerted effort, collaborative effort to make sure these illegal drugs don't find their way into the country. Now, if, according to the report, the recent one, illegal drug trafficking is a $400 billion industry.
Dollars.
Oh. $400 billion industry. So is it a lot of players are involved? Now, if you go to maybe a slum, a ghetto, and you go and arrest the users, you've done very little work. Because what we found is that there are kingpins, there are area lords who control those ghettos. You are not likely to arrest them there.
But you can lead the trail. The trail can take you there.
The people who use, get them help. Let them help you reach the kingpin, the area lord, who can also help you reach the next. There are levels to it. Ogboros at the top. Most of the dealers do not use the substance that they are dealing, because if you use your own cocaine, you cannot afford. If you use your own, say, tramadol,
you won't see your money.
You won't see your money. Your money is in there. You rather will have to go and buy from somebody. So most of them do not use these substances, and most of these dealers are unassuming. You wouldn't know. Like we were talking about the last time, you see somebody pushing something and he's selling phone cases. He's selling.
So that's the cover.
Oh, it's a cover. There's a shop opened and they are selling things that nobody goes there to buy. It's a cover. It could be a hairdressing salon, it could be a pub, anywhere. It's a cover. But the users know where to go for these things. Once you stop that guy and you speak the language, they know that it is winning bread you want, it is cocaine, what is this you want.
I see. There's a question from Robert in Kwabenya. He says, and maybe we'll wrap up with that. Says, if doc says to stop taking these steroids for more energy and strength to boost my work input because they are unhealthy, what healthy options can I resort to?
Good. So first of all, if you become dependent on it, that's why you'll be saying things like this. So first of all, you need to seek medical help. Healthy options: exercising, eating well, you understand, practicing mindfulness, going for health checkups. Those are your healthy options. Exercise helps you be able to withstand stress. Once you exercise regularly, and we all know how difficult it is to be disciplined enough to have regular exercise. We all know how difficult it is. And WHO advises at least 30 minutes of physical activity at least 3 to 4 times a week. We all know how difficult it is to be disciplined to do that. So those are your healthy options. But the first most important question is, what made you start using the substances? It could be an underlying undiagnosed mental illness, like I'm saying, depression, anxiety, ADHD, PTSD. A lot of people are suffering from trauma. If you go to any drug rehab facility, or anyone who's addicted to any of these drugs, there's about 60 to 70% of them have an underlying trauma that they are recovering from. So they are using the drugs
as a cover-up,
as a cover to cope negatively. So the question is, why did you start using? Because there are people who are doing your kind of job who are not using, and they're also performing very well. So why did you start using in the first place? So that we try to solve the thing that is pushing you to use, so that you hopefully don't continue.
How are we marking this day, and then we'll wrap up, this year's National Drug Abuse Campaign Against Drug Abuse and Illicit Trafficking?
This is part of it. That's Mental Health Authority has a lot of professionals in lots of media houses, FM stations, TV stations, to create awareness and educate the public on the negative impact and what drug abuse actually entails. It's not just the smoking of weed or whatever. It's about the legal drugs can also be abused, and illegal drugs are also awareness creation and also advocating for government commitment to resource the let me say the facilities that are into providing care for the people who need help.
Doc, I want to thank you very much indeed for your time. Always a worthy resource to have here. Dr. Sedo here, we're grateful that you could join us. Thank you so much indeed. Now time for birthdays, and if it's your birthday, happy birthday to you.